Welcome everyone to this webinar with the Child Early and Forced Marriage subgroup of the Gender and COVID-19 Working Group. So I'm very happy to introduce today Helen Gatogo, who is the Executive Director and co-founder of One More Day for Children Foundation Kenya and One More Day Girls Safe House in Laikipia County. She's also the Vice Chairman of the County Education Board appointed by the Ministry of Education and a member of the Nanyuki Court Users Committee. The Safe House rescues and provides shelter, psychosocial services, and rehabilitation programs to girls who run away or are survivors of FGM, of female genital mutilation, child marriage, and beating and other sexual and gender-based crimes. The foundation has various programs aimed at addressing the problem, including rescuing survivors and other vulnerable girls, advocacy, awareness, and training on the negative effects, pro bono services to the victims, counter trafficking in children, and family rehabilitation and women's empowerment. And today's webinar is about how these girls and women are the other victim of the COVID-19 pandemic. So welcome again to Helen, and we're delighted to have you here. Helen, over to you. Welcome. We're so happy you're here.
Thank you, Mary. Thank you for welcoming me. Good afternoon, everyone. My name is Helen Gadogo, and I'm excited to be with you today here and share some experiences and some challenges we are experiencing on while dealing with COVID-19, especially affecting the girl child. Today, I'm going to talk about the other victim of COVID-19. But before I do that, I would want to first share a documentary that was recently shot by one of the national television here in Kenya on what we are going through and what we are doing, and the experiences as being narrated by the survivors themselves. So a little bit I'll be sharing, okay? Mary, can you enable me, please, to share the screen?
Sure. Sushmita, will you kindly make her the host or enable her to share her screen?
Please try now.
All right, thank you.
At the age of 17, far too young to understand childbirth or parenthood, Rhoda, not her real name, got pregnant with her first son. For the young girl from Chumvi area, Laikipia East, it all happened after schools were closed in March 2020 due to COVID-19.
Baada ya shule kufungwa, nilipata mimba, alafu nikakaa nyumbani. Wazazi wangu wakaanza kusema niende kwa mwenye amenipata mimba. Alafu nikakaa, wakanikaa kuniambia utaenda. Nikakaa, nikajifungua.
Afraid, alone and depressed, she remembers how difficult it was for her.
Sikuwa nataka kuolewa, lakini wazazi wakanifusia niende hapa.
She was forced to leave home with her baby and start a new life with her 20-year-old husband who completed high school in 2019.
Sikuwa nataka niolewe kabla sijamaliza shule. Maisha ya kuolewa ni COVID disaster. Sasa tunang'ang'ana.
Her story echoes those of hundreds of girls who are left vulnerable by the pandemic. COVID-19 led to unintended consequences, a rise in the number of adolescent pregnancies. When schools reopened in January, Rhoda decided to go back. She's now in Form 3.
Kasema nataka kuenda shule. Alafu wazazi wakaitikia, nikarudi. Ni ngumu kuolewa tena na unasoma. Sasa uwezi ukashika kitu. Wakati ninasoma, ninaitwa, alafu mtoto analia tena. Nikichukua kitabu anakaa kucheza hapa, kelele ndio hiyo. Maisha yangu nataka kuwa mwalimu, alafu nipate kuwasaidia wazazi wangu.
Since the outbreak of COVID-19, the government ordered charities to shut down rescue centers to ensure compliance with social distancing measures, leaving many girls vulnerable to the very ills they had escaped from. With schools closed for a period of 9 months, some girls were subjected to the cart. Others were married off. In Doldol, Laikipia County, the One More Day Girl Safe House provides refuge to girls who have fled forced marriages and female genital mutilation. The institution was started in 2011. COVID-19 brought sudden changes across the world in 2020, and the rescue center had to quickly adjust and temporarily close down. 16-year-old Betty, not her real name, is among 50 girls that currently call the institution home. Confidence radiates from her eyes, but just 5 months ago, she wasn't sure if she had much of a future. Betty ran away from home in 2012 and sought refuge at the shelter after her father decided she was ripe for marriage. The rescue center is a safe haven for her, but when it was shut down due to COVID-19, she was forced to go back to her home in Kipsing.
Wasasi walikuwa nataka wanikekete, alafu waniitie mzee anioe, na sikuwa nataka kuolewa juu nataka kumaliza masomo yangu nikuwe mtu wa maana baadaye. Baba alikuwa anataka nikekete na mama hakuwa anataka mimi niache shule. Sasa baba alikuwa na hiyo mfurugano akipiga mama akisema hapana, yeye anampiga hadi kuna siku alimpiga hadi akalazwa hospitali, alimpiga kichwa hapa akamkata.
Betty was in a dilemma.
Sikuwa nalala nyumbani, nilikuwa natoroka kwenda kulala kwa yenyewe. Siku nyingine nalala kichakani, hadi nikaamua kutoroka kwenda mahali ingine kwa sister yangu. Huko ndio niliweza kwenda kukaa na nikapigia mamele nikamwambia venye mambo yaliendelea, na akaniambia tafanya juu chini ili tuweze kurudi huko. Sikuwa na fare yote, nilitembea miguu siku 2 kuanzia Kipsing hadi huko. Njia ni ndefu na hadi kuna ndovu, kuna wanyama wengi sana. Sikuweza kupata usaidizi yote njiani.
For now, Betty is happy to be back at the rescue center.
My future is to be a doctor. So, nang'ang'ana sana juu nataka kusaidia wasichana wengine wenzangu wenye huko manyumbani. Wenye waliteseka kama mimi na wenye bado wanateseka. So, niko hapa kusoma, ndio maana sitaki kurudi nyumbani.
Doris, not her real name, chats with her sister. The two girls lost in conversation, seemingly choosing to pay no mind to their shared pain that brought them back here. Being in school offered Doris and her sibling a sense of security, but schools closed. The two sisters feared they could not this time escape the cart, and they didn't.
Wakati tumeenda nyumbani tukalala tu hiyo siku moja, siku ingine tunastukia watu wamekuwa wamejaa nyumbani. Kesho asubuhi tunastukia wamama wanatushika. Tulikuwa na namba ya Mama Helen lakini hapo haikuwa na network ya kupiga hapo na haikuwa na polisi. Wamama wengi wanakuja wanazunguka, mtu wanakushika, mwingine anashika mwingine na damu, tunatairiwa kwa hiyo pali moja. Kwa uchungu sana, na huyo mama alitukata hata vibaya sana. Wakati tena tulikuwa tumekaa nyumbani tunaambiwa kuna tena kama one more day itafunguliwa, tutaolewa tena. Na mtaolewa hata mtajua ni siku gani. Tulirudi Disemba huko, tunashindwa hata sasa one more day kizafungwa tunaenda wapi, na tukaenda office tu hiyo tutaolewa hiyo.
It's a year down the line. She can't go to the toilet properly, so we were thinking about taking her for reconstructive surgery because she says she's constantly feeling pain.
Doris and her sister escaped their torment at home when they were just 7 years old. It was a long trek from Oldonyiro to Doldol, surviving on just water to escape a forced marriage.
Sisi tulikuwa tunatoroka, tulikuwa tunajua tunaenda wapi. Tukakujanga, tukalala juu ya mti, asubuhi tukaamukia, mtu atakuwa karibu kuzimia juu ya njaa tu.
Through all the hardship, they still hope for better days. Margaret, whose name has been changed to protect her identity, has lived at the rescue center for 5 years. Her father had tried to get her to undergo the cut. With the shelter temporarily closed, Margaret in March of 2020 had to go back home, back to her persecutors.
Sasa nilienda nyumbani, sasa watu wakaanza kusema wanaenda kukeketa wasichana. Yaani wanachukua wasichana wakiwa watu wengi, wasichana marelative tu, wanachukua wanaenda kutairi mahali mbali sana huku Samburu chini. Baba ndiye alikuwa ni mkali sana. Sasa niende alisema nikekete.
She was determined to leave her nightmare behind and chase her dreams.
Wakati sasa watu walikuwa napangiwa kesho kufanya sasa hivi, nikatoroka hiyo jioni. Nikasema hata kama nitaenda kukuliwa na wanyama, ili nini nikuliwa na wanyama, but mimi siwezi fanywa hivi. Kulikuwa na giza mwingi sana na tena ni msituni, nikapatana na ndovu. Akasema ndovu unataka kusema ndovu itaniulia hapa? Si mimi nikangangana kwanza yangu nilifika saa 10 ya usiku.
Against all the odds, she has survived.
Wasasi tu wanasema kwa kimdomo tutamlaani. Mimi sikujali. Mimi nikakuja kama laana itanifuata, wacha inifuate.
For the girls, the rescue center represents safety and a hope for a better tomorrow.
Nataka nikae huku, nisome, nijue future yangu.
Nikikumbuka sasa nyumbani na hizi vibaya sana, hata siwezi tamani sasa niende nyumbani.
Kama sio masomo, hiyo maneno yote ulipitia itaendelea kuwa mpaka.
Helen Gadhogo is the founder of One More Day Safe House,
ndio uweze kumaliza ile uliona.
A home for young girls subjected to female genital mutilation and early marriage and robbed of their childhood and dreams. Since it started in 2011, the rescue center has rescued more than 1,000 girls, providing them with shelter, food, clothing, education, counseling and healthcare. Though the practice of FGM was criminalized in Kenya in 2011, thousands of families still perform it to date, especially in rural areas. The closure of schools and rescue centers created a ripe environment for the illegal practice to continue. In pastoralist communities, FGM transforms girls to women who are then married off in exchange for livestock.
When they went home for almost a year, a lot of them, about 70% of them came back when they were cut. And others are going through trauma. Right now, we have engaged a special person to do the trauma counseling.
We lost 11 girls to like pregnancy. So we don't even have some girls, we can't even like locate where they are right now. Our hard work, and you see we were progressing well, we've built the house. They are almost good girls, they are almost blossoming and kept crumbling down. We are now starting scratch.
I've just rescued
one girl. This girl has run away about 15 kilometers to this place. She's limping, she's emaciated, she has never been in school. She had been cut. It is so sad that the cutters are back, the FGM is back, despite the presidential directive that this be over and finished before 2022.
Right now in my village here where I am, the cases are happening at 99%. The chiefs in the locations, all locations of North, they are aware and they know who and when the FGM is happening. So I totally believe the Nyumba Kumi, the chiefs, and then now the police officers, if everybody was doing their bit, they know it is not right, but they can't report because they don't want to be seen like they are betraying anybody or anyone in the community.
After rescuing, then there is nothing happening as when it comes to arresting. Why? Because of maybe culture and also the terrain. Because once they do that, they run into the forest.
I personally reported 2 cases of early marriages. The father of the girls, yes, he was arrested. It didn't go anywhere because we were told we didn't have it, we didn't bring evidence. We should have brought the Morans who married this girl. Where will we get the Morans? It is the work, it's the arm of the government to know where those Morans are and bring them to book.
Carol, not her real name, is picking up the pieces of her broken childhood. She is the latest addition to the numbers at the rescue center. At the tender age of 14, she was married to a man thrice her age. Dowry had already been paid, but she ran away and walked over 20 kilometers to this safe house.
2 weeks to her staying here when she was going to school, she was abducted again by her brothers. She was taken back to the husband, and he trained a lot that night. So it stated that the man was really happy that he got very drunk. So she was supposed to move from that main house and visit the husband who had called her. And in between that, she ran off and came back. So she actually walked here in the morning and she was all wet and crying and said she doesn't want, she's feeling scared. Alleged husband has passed by the institution and was like uttering words like, "I'll get her back." The police have said that the guy cannot be found and they are looking for him, so we are awaiting that. The brothers were shooting in the institution, so we added one security at night. We followed up the case to know who was involved and we reported everything.
Data collected from local health facilities shows a worrying rise in pregnancies in girls aged between 10 and 19 years. By June 2020, a record of 678 pregnant girls within this age bracket attended antenatal clinic in various health facilities in Laikipia North. Laikipia North has the highest burden of teenage pregnancies with a rate of 57.4%, surpassing the county average of 27.1%. Laikipia West is second at 24.7%, while Laikipia East is at 15.1%. Some girls have now dropped out of school.
We had made such gains, and it is the whole system of it, from FGM, from reducing or eliminating early marriages. Now what is happening, when all the kids are back home, then those old traditional cultural things will catch up with us yet again. I think that we will, on the social side, maybe we will lose as much as 5 to 10 years in terms of the changes that had begun to take place.
Right here in Chumvi, one successful case of a defilement case that is successful. An adult defiled a minor, and this case right now is in court. So if this is a sign of things to come, then we are heading somewhere and things are turning well.
We cannot do the advocacy because of the protocol. We cannot bring people together. Because we have a lot of teenage pregnancies which are coming from teenagers themselves. We are having some girls who went back to school and they are going to school while coming from their husband and going back. And my prayer is for the judiciary to consider bringing a magistrate court down here instead of a mobile court. It's the highest time that we have it here at Children's Court to be closer to this facility.
Anti-FGM activists like Helen Gadogo are determined to turn the tide, but much more needs to be done as the pandemic threatens their hard-won progress. Ruzongoi, NTV, Doldol.
Well, thank you so much. I wanted to start from somewhere, and I hope everybody has gotten what is really happening. And before I continue, I would like to say that this is the real story. This is what is really happening in Kenya, in one of the districts at the northern side of Kenya, where we have the pastoralist community, the Maasai, Saburu, Redire, Turkana, and others. And that is where we have the safe house that serves about 4 counties. And when the pandemic hit, and then the government said that we ordered all schools to be closed down, as well as the offices that were very vital to the child protection, and also the safe houses, not taking into consideration that the safe houses host the survivors that had ran away from FGM or child marriages. And taking them back to their families, then it meant that like you are perpetuating or you are aiding the same, because it's like a betrayal. And this happened, and some painful experiences that you have had our girls narrate when we opened in December. And things continue to be the same. Much is still happening. And maybe after the video, I would like to take you through now the presentation. So that after that, if you, in case you wish to ask a question or clarification, then I will be able to be reading from the same point.
Thank you so much. Sushmita, would you like to facilitate?
Helen, is there a presentation that you are going to show, or you are done?
Yeah. Thank you so much. Thank you so much. I appreciate. I hope I've brought everybody closer home.
Yeah, definitely. So should we, Helen, should we open up for discussions?
Yeah, we could do that as my technical person works out on bringing my other power presentation, which is an adapt on whatever you have watched.
So Helen,
great, thank you.
Can I ask why the government shut down safe houses? I mean, from an infectious disease standpoint, I understand why they wouldn't want congregate living, you know, groups of people living together. But safe houses are so different than schools, as you just pointed out. Are they aware of the ramifications? Was this an oversight? What's being done now for planning for the next wave?
Definitely, like you are asking, that is what I, on the onset, was able to raise, and it was even highlighted in a global platform in the newspaper, which was quoting me, asking the government why they should have done, they have decided to close down the safe houses. But then this is the department which is supposed to be the implementing agency on of the rights and welfare of children according to the signed charter of international instrument like United Nations Convention on the Rights of the Child. That is the Department of Children's Services. And yes, they are aware because this is the department that is charged with the responsibility of ensuring that they secure and protect the rights and welfare of the children. And yes, they are aware because before any girl goes to any safe house, or once you receive these runaways, then the first person you have to invite is the children officer. The children officer is the one who now takes the case to court. And now you wonder why would they not advise the government against closing down, especially the safe houses? Somebody has also asked me, what about what's next? What next is now what I'm talking about, and that is we are back to square one. We have, like the governor of the area has said, we kind of have lost 10 years of great yield we have done. We have steps that we have been made. Right now, it's like it is becoming unmanageable because still we are still in the same wave. The children, yes, they are back, but the repercussions are back and very bad. And that is why I wish now to share with you my presentation, and you'll be able to understand the other part of what is really happening. Can everybody see?
No, we are able to see the list of your files, not the presentation.
Mm-hmm. What is happening here?
So Helen, very powerful video. So while the girls have come here, some of them have been the runaway girls as well. So do the families really push you to send these girls back, because they must be minor by legal? So how do you manage the thing?
Well, one thing you should realize is that it is not the family that, I would say some of the family members, especially women, aid in running away of these survivors, yes. But not many from the community who care about it, because the center looks like we are against the cultural practices. And we cannot send them back to the community without, because after you rescue, then the legal part of it take place, where you have to ensure that the perpetrators are arrested and they are taken to court, presented before the children's court and charged. But that is why you have seen one of the activists saying that we have a lot of children, we have a lot of girls, but there has been little of arresting of these people. This little that is happening when it comes to arresting and laying in court of these perpetrators. So the girls, like you have heard them, even others crying, they were hurting because they knew that they have been given back to the same people who had planned to take them through the cut. And right now, when they came back, Yes, almost now I can tell you is 80 something percent, they came back when they have been cut. Others had to endure hardship, like you have heard. Others would stay in the bush where we have wild animals like elephant, yeah, running away. Till when we as the organization, we gang together with the Girls Not Bride and others, and we were able to push for the reopening of the safe houses. Yes. Now, can you see the screen?
Yes.
Yeah, thank you.
All right. So, it's paused. Yes, I'll take you through the slides of the other victim of the COVID-19. Of course, every one of us knows that COVID-19 has upended the lives of the children and families across many countries, including Kenya, and is impacting definitely on efforts to end female genital mutilation and child marriages. You've already seen that in the documentary. Now, action that we are taken by Kenya government to contain the spread of the virus, like closure of all schools, definitely many countries did that, and the closure of safe houses. That is where the problem is. The movement restrictions, social distancing, closure of businesses, all of these disrupted the children's routine and their support system. There's no way, if a child has a problem, definitely the next place that they would go first, if it's not the safe house, they will report to the teacher. Now you don't have the teacher close, it is closed down. Then when the government enumerated the sectors that will be termed as essential services, the children sector was not enumerated as one. Therefore, even the children officers themselves, we are working from home. And when I'm saying working from home, remember they come from other districts. And when any person would be called, they will say, no, me, I'm not there. I'm working at home. So they're very little that they could do. Now, we know girls especially are disproportionately affected during any public health crisis, like what happened with Ebola and other emergency situation. So many girls have faced the threat to their safety and well-being, including the GBV, gender-based violence, exploitation, including the sexual exploitation and harassment. There has been also neglect, exclusion, and separation from families and caregivers, because we are going to see that others were even being given out because this family was not able to take care of their own children because maybe of poverty or loss of livelihood. So therefore, these have undermined One More Day for Children Foundation strategies and efforts to end FGM, child marriages, sexual exploitation, and threatened the progress that we as an organization had made over the last 10 years. Now, I'll take you through the experience, the real experience, what really we are observing and what we have observed direct in the field. Remember, we are working within the community. So we are community-based organization. We are seeing it as it is. And number one, we observed, and we are up to now observing silence and challenges in detecting cases of FGM. It is happening because we still have curfews, especially at 7. You should not be loitering around. But those times the first wave was too tight, and the second wave. Now with these curfews, limited movement and social distancing, the usual channels through which these girls especially would be able to access social support, we are totally cut off. I've enumerated the things like schools, institutions like schools, the civil society offices, we are forced to close down, where these girls would run to, or some activists would run to and report. churches to places of worship, safe houses like one model girl safe house. So access to assistance was totally limited to telephone or cell phone, if you like it, which are not available to many families where we are working. It is an arid and semi-arid area due to poverty and lack of internet connectivity. It was, therefore, the FGM was being done inside deep forests where there are no even roads, yeah, and no girl could escape, and the police could not even access the places due to lack of these roads. And also there was heightened alert on insecurity during the COVID-19. I remember one time, one of the girls reported, called us for rescue. And I had to call the county commissioner of our neighboring county called Isiolo County. And I remember him telling me I cannot risk to lose my policemen, because two weeks ago, they went to rescue one girl, and about 70 men, the Masai Moran and Ren, came with the sword and spears wanting to kill these chiefs and all that. Would you imagine? This is somebody who is in power, in authority, and is also fearing, you know, in rescuing this girl. Number two, we also have the cutting continued due to the prevailing conducive environment. Of course, I've said the schools were closed down, safe houses were closed down. So what happened is the cutting, the circumcision took place at night, yeah? And what they were pretending that they were doing the boy circumcision. And within these igloos called lororas is where the girls were put together, like you had one girl saying, and those who went back to the parents or from safe house escaped. When they came to us, they had escaped this cut. But when now they are coming back after we were given a go ahead of reopening their cut. So it's a total betrayal, trauma counseling right now, like we have said. We have a couple of them which were requiring reconstructive surgery. They don't, even if they want to go to urination, they are having a big problem. Now you can imagine when they're having menses, what will happen. Now, this is a big problem right now that we are facing with a couple, about 5 of them and 10 of them having a serious matter to be addressed medically. There's also loss of livelihood. So most guardians and parents lost their jobs and businesses. So what happened is girls became commodities for trade. So there was ripe ground for FGM. And of course, when I say FGM, is a precursor to child marriage, because immediately you are cut, then you are prepared now to go to the next step. So families engaged in dowry exchange so as to caution their families. Imagine, exchange of dowry triggered FGM, which is a precursor, as I've said, to child marriage. And also we have witnessed a comeback of the former cutters. Those who circumcisers are back, and because the business is booming. We had taken them through the education on ASRH. They had abandoned, but now they are back, citing their challenges that they don't have a source of income to keep their family, and they had to go back to what they knew better. Now, another thing we are experiencing is sex for food and sanitary towels. So most girls, after now leaving the safe houses and as well as the school where they were used to get this free commodity, they could not access this commodity to use during their monthly periods. So what happened is they became very vulnerable, and they would give in to unprotected sex in exchange for pads, and others to get few coins to buy food and water. Remember, this is a health crisis requiring a lot of water. And if you have watched clearly the documentary, it is a dry area there's no water, there's a literal rain in a year, and therefore requiring that every now and then you are washing your hands. It's only 20 liters jerrycan, which is supposed to be used by the whole family. And then this is the same one that you are going to cook and drink with. So you would rather not wash, or it is that bad. So consequently, most of them, they became pregnant, and the men escaped, because up to now, I've only one case that has been cited that have been able to be taken to children's court. There is also an insurgence of teen and to teen pregnancies. Yesterday, I was having even a discussion with the Ministry of Education. They had called me because there is one school that is almost getting, closed. We are having these teenage pregnancies, a primary school, day school, but now they have to come up with a section of boarding to put the girls that are pregnant. And there are now too many. And most of these girls have been made pregnant by their fellow boys. Why? Because boys were taken through the circumcision before they finished the primary education as usual. So now coming back, who are you to tell me that you're not going to sleep? So if they get any girl on the way, they rape them. When they get the girls looking after animals, they rape them. And it is becoming like a school is having 6 or 10 teenage pregnancies. Others have not even reported back, while others are even, at home and accounted for. So there's also others who have been impregnated by their own kins, So you get like unbelievable stories where you have the brothers turning to their sisters, a cousin, making them pregnant, Such children are now in this culture, community totally are considered to be a curse, and the community cannot keep them. So they would rather, throw them away or kill them. And you see now that is a ripe ground for child trafficking. So what we are having even right now in the safe house, we are having babies with babies. We are having 12 years breastfeeding. Why? Because we had to bring her back together with the baby because it's as a result of this incest. Now, families are left in dilemma while a number of them have decided to end their lives. There has been a lot of cases reported to do with suicidal cases. So we also have observed a rise in drug and substance abuse by children. They would even traffic some for livelihood. In this local location where you have seen with the Maasai and whatever, they have local brews, and they also have other hard drugs like cannabis sativa. So they also have these cat, the Mira. So schools, children right now are attending school when they are drugged. Yesterday, it was totally a chaos when one of the schools, the police had to go in because about a third of the class is drugged. And they are looking at the teacher with wide eyes, but no, they are not listening anything. They are already drugged, because children now are bringing drugs in the school, trafficking, and also parents themselves are also the customers. They are the ones selling these. And when you approach any parent, they become also like, why do you care? It is his own life. So it is becoming so hard for Ministry of Education, Ministry of Education is unable to handle the situation since parents themselves the ones selling drugs and alcohol to children. Now, of a great concern, we are observing many married girls attending schools from their own husband. You have seen one of the cases sampled. So you can imagine your student at home, your student during the day in a day school, and a wife during the night. and a mother, and sometimes you're pregnant, and you have to give even conjugal rights. Even back at school, your friends are talking about you, the stigma. So it is hard. But this is the scenario. Now you tell me that when somebody is saying that they are not able to arrest the perpetrators, then how come they have not arrested this one who has already married this one girl? So you can see there's a hesitant in law implementation. You ask me why? I'll just say I don't know, because when a government signs and ratifies the UNCRC, you expect everything to be done the right way. So it only means that chiefs were implementing the presidential directive of ensuring all girls go back to school, whether pregnant or not, but left the part of arresting and prosecuting these perpetrators. All right. Now, there has been also a rise in cyber crimes. When schools were closed, most teenagers got used to internet. Yeah, those from well-to-do families, and unlimited freedom. They had unlimited freedom because the parents are away, and during the day they are in the internet. So they engaged in online businesses, like something they're calling it crypto money, like that. In online businesses, making money. And so when schools opened in January, many of them had refused to go back even right now. So some of them, those who went back, some of them have resulted in violent activities at school. Some are attacking teachers with crude objects. We have had some cases of teachers losing their lives through by being beaten by some students, especially boys. So others have resorted in killing their own parents, and others, they are imitating some characters in certain movies that they have been watching during that COVID break. So it is very sad. Others got employed to harvest sand, make illegal beer in villages, or tilt land. And when schools opened, they did not see a reason to go back to school. To do what? The business was bringing in money and freedom. So this has brought about many fights between children and their parents. There's a lot of domestic violence as a result of this. So other children are trafficking, as I've said, and schools have become totally unmanageable. And male circumcision also has contributed to more suffering to the schools, especially to have brought about more GBVs cases. Many young boys, especially from Masai, Saburu, Yakun, Torombo, and Redire, were taken through circumcision during the school closure before they finished their national exam to go to high school. So when they came back, right now, they are resisting to be taught by any female teacher. Yeah, so who are you? I can't sit in a class where a woman is the one who is talking. And yesterday, that the same school, when the authority went there, and they were told they were going to be arrested and it is going to cost them in their future, they were like, do what? Do what you can. And I'm talking about the other age, and I'm talking about boys. Now you can imagine these are the boys who are raping girls left, right, and center. And it is chaos. That is why you're seeing 57% of the girls in this district are pregnant, and already others have given birth. So thank you. That is all I can say. And that is, I will form the discussion for today. Thank you.
Thank you, Helen. That was really interesting.
Thank you, Helen. Helen, Savita here. I have one question. Yes. Has the FGM increased after the law was passed? I mean, is there some kind of backlash against the law to prevent FGM?
Totally. Like it has taken us back 10 years from wherever we were. It is back 100%.
Oh.
I have a question about moving forward. I mean, this is devastating. Everything you're saying, not maybe surprising to this particular panel, but devastating nonetheless. I'm just wondering, what you think should be done. Like, is it a matter of policy where those child protection officers should be deemed essential? I mean, I think that's been a critical thing in a lot of countries, mine included, where they were not deemed essential at the beginning. Is it that they need to now expand, have schools for pregnant females? Like, what is the next step if you had an ideal situation? Like, if you could dictate programming and policy, what would you see happen?
Yeah, thank you so much for that question. And I keep on asking for somebody to ask such questions. Now we are in this situation, so what next? What are we going to do? Now, number one is we need to come back with programs that are advocacy in nature. Number one is to have programs that are going to target the teenagers themselves, the parents themselves, the authority as well, for the purpose of formulating or proper implementation of the policies that are there. Like you have heard in the documentary, Kenya has declared FGM as illegal. And the president had promised the world that by 2022, when he is exiting, it will be a thing of past, and had put in place a board, anti-FGM board. But now look at where we are. This is a cultural thing which has been brought back by this unfortunate pandemic. So what do? Number one, like One More Day for Children, we still like we need to address it from advocacy level. We have put up health, adolescent sexual reproductive health services center. Well, this is, we depend on grant and well-wishers from well-wishers, but now we need to come, to have somebody to come with us and also help us to equip and equip this facility and register, so that we have the adolescent and youth and the youth themselves being brought in and taught on the risky behaviors about the sexual and reproductive health, and how to make choices, decision-making process. That is number one. Also to do the trauma counseling, because right now a lot of girls are hurting. We need that is the facility that everybody is looking at once it starts operating, so that it can offer these services. So the other thing is also to have a candid talk with the authority. How do you do that? After we sat down, what we have done is we brought in 1 week, we were able, as Girls Not Bride partners, we were able to bring, to sample some few clan elders, traditional elders. And we were able even to show them what was really happening, that video, as well as the cutting itself. And they were able to state that they are going to abandon the practice, but this is a matter of saying, yeah. So we need to take it from there, come up with a survey, do the mapping of those areas that are really have a really high number of such cases, and now we design a program where we can address these together with the community members themselves. And the other thing is, I'm a champion of child rights. I believe that once the child knows her rights, they are able even to protect themselves. This is the time now we have to go back and introduce rights of the child clubs, or anti-FGM, or whatever it is, the clubs and child-to-child clubs in schools, where these teenagers and girls themselves, and even boys as the future husbands, are brought in, and they are taken through the what do you call it, the morphology of the body, and also the adolescent and sexual reproductive health system, and they are able now to make informed decision in future. That's the only way. If you bring in male and we bring in the boys, that they will be able to embrace and even protect these girls. And now, because we are having more girls with who are pregnant, and also others who have given birth and they cannot go back to school. And if they go back to school, then there's the other part of the children. We need also to look at the welfare of these girls so that their life is not cut short, that they are able even to go and continue back to school. That could be like coming up with the programs where you are having teenage mothers, like we are having, you expand that program so that you are having the mothers during the night, and then they can go back to school as they continue going through the counseling. And lobbying is also something at the national level, so that the government is taken to task to ensure that it starts with whatever it promised, and ensure that every child, every girl is protected, and every child born of teenage mothers is also protected, because it's not their problem. Yeah, those are some of the programming issues I can talk about. Peer counseling also, as well as coming with peer-to-peer education, is also another way that we can also look at it. Thank you.
Hi, one more question. How has the pandemic affected your funding? Because you need a lot of money to take care of girls in distress and trauma. So what is the situation in Kenya?
The situation in Kenya, especially to the civil societies that depend on grants and donors fund, has been worsening day by day. For us, for example, one more day, we have lost a lot of donors as a result of this pandemic, because some lost their jobs, some also lost their lives, and the funding has been dwindling and dwindling. We also used to get some people would visit the institution with some food, old clothes, and all that. Today they are not. We are not getting any, because they have been going through a lot of problems. So right now, our appeal is to the partners and international donors to join hands with One More Day for Children, because we already have the land, we have all the capacity, so that we are able to join together and put up the facilities where we can expand and get in more survivors, as well as help us in enhancing our capacity, so that we are able to expand further, because our services, like you have heard, is much required right now. People are desperate. We are also desperate. I cry and I feel bad when I see a girl being turned away in any institution where she's running away just because there's no funding. The beds are full. There is no bed remaining. It is a human rights crisis right now.
It's really devastating, as Rachel mentioned. I can't believe this is happening in 2020. I mean,
imagine the only donor that right now has remained, although the funding once again has been going down, is the Czech Republic. There's a Czech Republic. They have been able to raise some substantive amount of money to put up that facility, and also ensure that there's the kids eat and all that. But now they are also warning us and raising a red flag that they are not able. Yeah, there's a One More Day endowment fund, which is also dwindling, and we don't know, and we cannot even believe or even think of what would happen tomorrow if the fund closes down. The other donors have been down and down, both from Kenya and other international communities, but we are open to partnership. Yeah.
Yeah. Helen, I have been absorbing. I think it's very difficult many times to react and respond to such a devastating scenario. It seems that people do not have a vision for their life. Somewhere we do need to create a different vision, or maybe put different aspirations for life in this young minds, so that they can chase a different dream. although sexual and reproductive health is one approach to tackle it, but we need to also shape up that what is our young people or adolescents is all about. So it seems that they do not have a pathway for their future life and adult life to be really like, having a quality life.
Yeah, there's a lot to do with life skills and the mentorship program required. And this is one way, like you're saying, whereby already, like you have seen in the communities, like there's very little to do with there are few mentors or role models from the community that you have seen me showing the video. And therefore, it is like even girls and women are also giving up on themselves, especially adolescent girls. There are a lot of sexual exploitation. There are a lot of sexual abuses, east, west, and north. And I didn't tell you that right now it is because, of course, you cannot get pregnant if you had protected sex. HIV and AIDS, HIV and AIDS, the number has gone once again up. So it's another crisis coming in. So we need also, like you have said, to engage in mentorship and life skills for the children and adolescents and youth.
Yeah, of course. People need different role models because they need to know that there is an alternate lifestyle also possible. There is an alternate act they can do. So I think nowadays, because of COVID, everything lockdown, shutdown, people are losing all those thinking abilities and looking beyond, activities that is happening around.
Yeah,
I'm a little conscious of time. Well, yeah, please, Helen.
Yeah, within these 3 days we had with these elders, what we do as one more day so that we show like we are not saying that everything cultural wise is bad. We are only trying to pick the bad part and changing it the other way around. We take girls for about 4 months training on life skills, mentorship, and then later they graduate with alternative rite of passage. Now, according to them, it's like they have bought the idea that we do all what traditionally we do, but minus the cut. So alternative rite of passage as a program right now is what we are going, it is what is called for, and it is the best one because it can bring right from adolescent and youth, bringing and teenagers together, and they are able to be taken through everything to do with the health issues, whether it comes to positive traditional issues, but minus the cut. So also alternative rite of passage is very important right now.
Yeah, absolutely, absolutely. You're so right, and I'm so so appreciative, and I'm so respectful to you that you are doing such a great work there. So we are a little conscious of time as well. We're a little over. Bahie, do you have any questions further to Helen?
No, I just want to extend our appreciation, as was just mentioned, for the excellent work that's being done, and also for joining us today and sharing this. And I'm glad that we get to record it so that we can continue to listen to it. We can share it with others who, with the time difference and whatnot, weren't able to join today. So I hope that we continue to learn together. We can continue this conversation maybe in some form. So we hope that this relationship continues and that we continue to learn from your experience. So thank you so much for joining us today, Helen, and on behalf of your organization. Thank you.
I am humbled in Bahie, Submita. Some of these problems, like as an organization, we experience, like you have seen yourself, the terrain. We do the capacity to reach wherever the girl is very minimal because we do not have things like transport is an issue. It requires strong vehicles to go, and also we also need legal team to be able to to investigate some of these things, and also fully functioning youth, adolescent and youth friendly health center, where this everything will be offered, because many of them do not go to hospital in fear of bad languages used by the medics. But here we want to establish a friendly center managed and run by the youth, and without a protocol, so that it can enable many of them to be coming in case of they have any problem. So in case of any in your platform that you can get any who can help or join together with us, we are going to be very appreciative in capacity building the One More Day for Children. Yeah.
Great, great. So thank you a lot, Bahie. I think it was a great learning experience, and we learned a lot. And it would be good to now say thanks, Helen. Thanks a lot. And of course, as I mentioned, that we would be doing a wider circulation of this video so that more and more people are getting to know about your work and really see how we all can learn and support each other.
Thank you. Thank you. Thank you so much. And thank you to Girls Not
Thank you,
Blind.
and all the best wishes.
Thank you, Savita. Thank you, Sushmita and Bahie. God bless you.
Thank you.
I love you.
Okay.
Bye.
Thank you. Bye-bye.
Bye-bye.
So Helen, you are the host. You need to close it first.
I think so.